From AI that listens to your doctor's conversations to wearables that do more than just count steps, this is the future knocking on our door. Let's get into it. For years, the idea of longevity felt like something reserved for Silicon Valley billionaires and sci-fi movies. But 2025 is the year it gets real, practical, and personal for all of us. We're moving beyond abstract concepts and into actionable strategies. This isn't about finding a mythical fountain of youth, it's about extending your health span, the years you live in good health, using tools that are accessible today. We're talking about a powerful combination of targeted lifestyle changes, advanced medical screenings that catch problems earlier than ever, and consumer technology that empowers you to track and improve your biological age, not just your chronological one. It's a fundamental shift from treating sickness to actively building and maintaining wellness over a lifetime. The key here is personalization. Your path to a longer, healthier life isn't the same as mine. It starts with understanding your unique genetic predispositions, analyzing your blood work with a deeper level of insight, and using that data to make informed decisions. Maybe for you, it's a specific dietary adjustment based on your metabolism. For someone else, it might be a new exercise regimen or a focus on improving sleep quality, which we know is crucial for cellular repair. The technology is finally catching up to our ambition, giving us the feedback we need to optimize our bodies and minds. This is the year longevity stops being a buzzword and becomes a concrete part of your healthcare plan. If you've been to a doctor recently, you probably noticed them spending a huge amount of time typing into a computer. It's a massive source of physician burnout and a barrier to genuine patient connection. But that's about to change dramatically with the rise of AI medical scribes. Imagine a doctor's visit where your physician can give you their full, undivided attention, making eye contact and truly listening to your concerns. In the background, an ambient AI tool is listening to the conversation, intelligently understanding the context, and automatically generating all the necessary clinical notes, summaries, and even patient instructions. This isn't just a simple transcription service, it's a cognitive partner. These AI scribes are designed to understand medical terminology, differentiate between the doctor's speech and the patient's, and structure the information perfectly for the electronic health record. This frees up hours of administrative work for doctors every single day. That's more time for seeing patients, more time for thinking critically about complex cases, and frankly, more time to be human. For you, the patient, this means a better, more focused experience. It means your doctor is less likely to be distracted or burned out, leading to better listening, more accurate diagnoses, and a stronger doctor-patient relationship, which is the cornerstone of great medicine. GLP-1 medications like Ozempic and Wegovy have been absolute game changers for treating type 2 diabetes and obesity. But the medication itself is only one part of the equation. The real revolution in 2025 is the synergy between these powerful drugs and sophisticated digital health platforms. We're learning that to achieve sustainable long-term success with these treatments, patients need more than just a weekly injection. They need support, guidance, and accountability. That's where digital health comes in, creating a comprehensive ecosystem around the medication to maximize its benefits and manage its side effects. This is a perfect example of technology and pharmacology working hand in hand. Imagine a patient on a GLP-1 medication who is also connected to an app. This app provides personalized nutritional guidance tailored to prevent common side effects like nausea. It offers exercise plans that complement the drug's effects on muscle mass and metabolism. It connects them with health coaches or support groups of other people on the same journey. The platform can track their progress, celebrate their wins, and provide crucial data back to their doctor, allowing for real-time adjustments to their treatment plan. This integrated approach transforms the experience from just taking a pill to embarking on a guided, holistic health transformation, leading to far better and more lasting outcomes. For a long time, continuous glucose monitors, or CGMs, were exclusively for people with diabetes. But we're now seeing a massive trend of non-diabetics using them to gain incredible insights into their own bodies. I've tried one myself, and it was honestly eye-opening. A CGM is a small wearable sensor that tracks your blood sugar levels in real time 24/7. Seeing exactly how my body responded to a bowl of oatmeal versus eggs for breakfast, or how a stressful meeting caused a glucose spike, was incredibly powerful. It's kind of like having a fuel gauge for your body, showing you precisely how your food choices, exercise, stress, and sleep are impacting you on a metabolic level. This isn't about being afraid of carbs or obsessing over every little spike, it's really about data and personalization. For the average person, a CGM can help you identify which foods give you sustained energy and which ones lead to a crash. It can show you the benefits of a post-meal walk in stabilizing your blood sugar. This knowledge empowers you to build a diet and lifestyle that is perfectly tailored to your unique physiology. It's actually one of the most powerful biofeedback tools we have for optimizing energy levels, improving mental clarity, and making proactive choices to prevent metabolic issues down the line. In 2025, you'll see these become much more mainstream as wellness tools. We've all heard about ChatGPT and its creative power, but the real impact is now being felt inside the hospital walls with medical-grade generative AI. This is far beyond the AI scribes we talked about earlier. We're talking about powerful AI models, trained on vast amounts of medical data, that are becoming co-pilots for physicians. Imagine a radiologist looking at a complex MRI scan. The AI can analyze the image in seconds, highlight potential areas of concern that the human eye might miss, and even draft a preliminary report based on its findings. This doesn't replace the radiologist, it augments their expertise, acting as a second set of tireless, incredibly precise eyes. The potential applications are staggering and are already being rolled out. In the emergency room, AI can analyze a patient's symptoms, lab results, and medical history to suggest potential diagnoses, ranked by probability. It can help doctors draft replies to patient messages, summarizing complex information in easy-to-understand language. It can even help design clinical trials by identifying ideal candidates from millions of patient records. This technology promises to reduce diagnostic errors, speed up treatment, and handle the overwhelming data load in modern medicine, allowing doctors to focus on the most critical, human aspects of care decision-making and patient communication. While massive AI models like GPT-4 are incredibly powerful, they require huge amounts of computing power and a constant internet connection, which isn't always practical in a healthcare setting. Enter the small language models, or SLMs. These are leaner, more efficient AI models designed to perform specific tasks extremely well, but without the massive overhead. The beauty of SLMs is that they can run directly on local devices, like a doctor's tablet or a piece of hospital equipment, without needing to connect to the cloud. This is a huge deal for privacy, security, and accessibility. Patient data can stay within the hospital's secure network, reducing the risk of breaches. Think about the implications. A paramedic in a rural ambulance with spotty internet could use an SLM on their device to get instant guidance on a rare condition. A nurse could use a handheld tool with an embedded SLM to instantly summarize a patient's chart right at the bedside. These models make AI more democratic and deployable. They can be integrated into existing medical devices, making them smarter without requiring a complete and costly overhaul of hospital IT infrastructure. In 2025, SLMs will be the unsung heroes that quietly bring powerful AI capabilities to the front lines of care, making healthcare more efficient and secure everywhere. Medicine has traditionally been a reactive field. You get sick, you go to the doctor, you get treated. But, what if we could predict health problems years or even decades in advance? That's the promise of future thinking, a new paradigm in healthcare powered by predictive analytics and AI. Now, this isn't about fortune-telling, it's about using massive data sets, including genomic data, lifestyle information, and long-term health records, to build sophisticated models that can forecast an individual's risk for specific diseases like heart disease, cancer, or Alzheimer's. It's really about seeing the storm on the horizon long before the first drop of rain. This changes everything for both doctors and patients. For physicians, it means they can create hyper-personalized prevention plans. Instead of generic advice to eat healthy, they can say, based on your specific risk profile, reducing your intake of this particular food and starting this specific exercise could lower your 10-year risk of a heart attack by 30%. For you, the patient, it gives you a roadmap for your health. It allows you to make targeted, impactful changes today to change your health destiny tomorrow. In 2025, this forward-looking approach will become an essential part of comprehensive medical care, shifting the focus from treatment to preemptive and predictive prevention. For the past few years, it feels like wearables have hit a plateau. Your new fitness tracker might have a slightly better battery or, a shinier screen, but is it really giving you fundamentally new insights? The market is just saturated with devices that are good at counting steps and tracking basic sleep. But honestly, the real innovation is happening under the surface. The evolution isn't in the hardware itself, but in the sophisticated software and AI that interprets the data it collects. We're moving beyond simple metrics and into the realm of real clinical-grade diagnostics. The wearable of 2025 isn't just a gadget, it's becoming a serious medical device. A fantastic example of this is AI-powered cough detection. Researchers are developing algorithms that can run on a smartwatch or even your phone, listening to the sound of your cough and analyzing it to determine if it sounds like COVID-19, the flu, or another respiratory illness. Think about that for a second. Your watch could give you an early warning that you need to get tested, days before you might feel seriously ill. We're also seeing advancements in passive, continuous monitoring for things like atrial fibrillation, sleep apnea, and even changes in your gait that could predict a risk of falling. The hardware isn't the story anymore, the intelligence is. The future of medicine isn't about AI replacing doctors. It's about forming a new, more powerful team. The patient, the doctor, and the AI all working together. This collaborative approach is going to make healthcare more efficient, more accurate, and more patient-centric. A perfect example is in the field of dermatology. Imagine you find a suspicious mole. In the old model, you'd have to wait weeks or even months for an appointment with a specialist. In the new model, you take a picture of the mole with your phone using a specialized app. An AI instantly analyzes the image, comparing it to millions of others to assess its risk level. If the AI flags it as low risk, it might provide reassurance and advice to monitor it, saving you a trip to the doctor. But if it flags it as potentially concerning, the app immediately forwards the image and the AI's preliminary analysis to a dermatologist. The dermatologist can then review the case remotely, prioritize it if it looks urgent, and bring you in for an in-person examination and biopsy much faster. This AI triage system ensures that specialists spend their valuable time on the most critical cases, while patients get faster answers and peace of mind. It's a win-win-win that really demonstrates how human expertise and AI efficiency can create a better system for everyone. In the world of health tech, we often get dazzled by incredible futuristic hardware. Giant MRI machines, sophisticated robotic surgery systems, and complex lab equipment. While these innovations are amazing, they often face a harsh reality. They are incredibly expensive and difficult to scale. A hospital can only buy so many multi-million-dollar machines, and they are often inaccessible to smaller clinics or patients in lower-income areas. The hard truth is that the most impactful innovations aren't always the most complex or expensive ones. There is a growing and necessary shift in focus towards affordability and scalability. The real challenge, and honestly the biggest opportunity in 2025, is to create health technology that is cheap enough to be ubiquitous and simple enough to be used by everyone. Think of the move from expensive lab tests to affordable at-home testing kits, or from bulky hospital monitors to simple smartphone sensors. The future isn't just about a new surgical robot that costs $5 million, it's also about a 50-cent paper-based diagnostic test that can detect malaria in a remote village. The industry is realizing that for a technology to truly revolutionize health, it has to reach the masses. This focus on frugal innovation will be the key to closing the health equity gap. So there you have it. 10 trends that are not just on the horizon but are actively reshaping medicine as we speak. From practical longevity and intelligent AI scribes to the powerful new team of humans and machines, these aren't just incremental improvements. These 10 trends are just the beginning of a medical revolution. We're at a pivotal moment where technology is giving us unprecedented tools to understand our bodies, predict disease, and personalize care. It's an incredibly exciting time, but yeah, it can also be overwhelming. The key is to stay informed and engaged. My commitment to you here at A Healthy and Scientific Lifestyle is to keep breaking down these complex topics. I'll keep tracking these innovations, separating the evidence from the hype, so you can understand, use, and benefit from them. The goal is to empower you to have more informed conversations with your doctors, and to take a more active role in managing your own health journey. Because the future of health isn't something that just happens to you, it's something you can help create. Thank you so much for watching. If you found this valuable, please give it a thumbs up, it really helps the channel. Subscribe for weekly insights into the future of health. Visit my channel for deep dives, reviews, and evidence-based lifestyle tips. Let me know in the comments which of these trends you're most excited or even nervous about. I read all of them. Until next time, stay curious, stay healthy, and stay informed.